This patient primarily has the issue of tendinitis. Now, many housewives at home, some laborers, people who frequently use mobile phones, and those who like sports, such as badminton, tennis, etc., can all cause tendinitis. The characteristic of tendinitis is that basically our hands cannot recoil when moving in certain positions, and also tennis elbow. The entire elbow will feel sour and swollen, and it is almost impossible to rotate, internally rotate or externally rotate. In this case, we can choose to use hand massage to relieve it, including tendinitis and tennis elbow. Since tendinitis is mainly a tendon being pulled, we will choose to bend the elbow first. Then we can see this line in the middle of the gap and then pull the tendon down along this line. This place is also our Kuchi acupoint. We continue to pull down from this acupoint. In the process of pulling, as we move downward along the muscle, we will find some hard things on the tendon, and it may hurt when pressing. Along this direction, we continue to rub to the wrist area. What we are doing is basically a technique of pulling tendons, rubbing the tendon and then moving downward a little bit. It is recommended that everyone relax their arms after work to prevent tendinitis in the future. When we get to the wrist area, we mainly try to support his wrist with our hands. After supporting, then do a local rubbing. All the way to the palm above the wrist bone. What needs to be noted here is that you can't press the wrist joint too hard, otherwise it is easy to cause wrist dislocation. We usually pull it horizontally like this. Do not press it up and down. You may ask why the treatment of tendinitis goes from top to bottom to pull this tendon. This is because this tendon directly influences the movement of our thumb. They are closely related. If it is the thumb that has tendinitis, it is not possible to flick it like this, it can only be done like this. In this case, we need to find the middle position of the Deuji acupoint, and then press with the thumb or index finger like this. To make it clearer for everyone, we now choose to use the index finger. When pulling like this, the patient will have a quick pain sensation. If the tendinitis is more serious, we will find a granule inside. As long as this granule is rubbed open, it will basically get much better. If you just found out that you have tendinitis, it is recommended that you rub it open as soon as possible. The next step is to press and rub the root of the thumb. Then we continue to press and rub at this position. This can be done every day. After rubbing, remember to wear a wrist guard to relieve the pressure on the arm. I usually also advise everyone to often press the Deuji acupoint before resting at night. Like this patient, the color of his Deuji acupoint is relatively dark. In this case, his bowel movements may not be very good. The patient's dampness is also relatively large. So often rubbing the Deuji acupoint can promote intestinal peristalsis. Next, we pull the palm root. Looking at the palm root, we can pull it to the palm root like this. The palm root is basically our first joint. It is its reflection zone. Now the patient can also operate it himself. First find the painful point. Press it and then rub it. Then press hard. The painful point should not be so obvious. If you don't have tendinitis, this point will not hurt. If you have tendinitis, this position will hurt as soon as you press it. Please note that we must press it and then use force like her. Do not press on the skin. After doing this, some inflammation will appear on the skin. At this time, we can also choose to do moxibustion. Do a moxibustion on the hand at this position. The situation will quickly improve.